like a ransom note. If I give in, will you come home? I put everything I had into getting you back. I was only 17.
Hello beautiful people, and welcome back to another video. My name is Sakshi Patel. I'm 5th year pharmD student from today onwards. I am so happy to be able to talk to you guys again. I had my university exams literally for 2 months, so I'm really sorry for not updating you guys, but at the same time I was constantly uploading study with me videos, so I really hope that they have benefited you, because I guess a lot of you guys are still having your exams. So all the best, and those who have already completed your exams, again best of luck for your next year. So in this video I would be discussing Pharmacotherapeutics 3, that is Pharmacotherapeutics of 4th year, followed by my university paper. Okay, so first half of the video I would be discussing about all the important topics of PT3, and in the second half I'll be discussing my university paper of PT3. Okay, and also about notes, they would be up by today is 10th, right? So all the notes, they would be up by 19th of July. So yeah, a lot of you guys have been mailing me for 4th year notes, so they would be online from 19th of July. And if you want me to share my notes, then you can always mail me at the mail ID patelsakshi164@gmail.com. Alright, so first let's start with syllabus of PT3. Okay, the important topics. So first we have gastrointestinal system. In that we have peptic ulcer disease, that is PUD. Now in this PUD we have two types, right? In pathophysiology is very important, and another question that comes a lot of times is that how would you treat a patient with the goal of eradication of Helicobacter pylori? So there are two causes of PUD. One is NSAID and the other one is H. pylori. So how would you eradicate H. pylori? That treatment is asked a lot of times, and in my notes there is an amazing table of 4 to 5 types of treatment, and because it is in a table form, it is it looks good. Rather than answering everything in form of passage or points, a table looks good. So I really hope that you guys learn that table. Okay, if you have my notes, then I would really prefer you guys to learn that table. And also for pathophysiology is very important. So pathophysiology of H. pylori and NSAID induced PUD is very important. That is also given in my notes. Along with that, difference between duodenal and gastric ulcers, duodenal ulcer and peptic ulcer. Yeah, so these two are also important. That difference is also given table wise in my notes. And if you are someone who is not referring to my notes, then also I would suggest you guys for learning everything table wise or in a flow chart form. That is really preferred for GTU, not GTU only, but all the university examinations. All right. Okay, and for pharmacotherapeutics, one thing that you have to note down is that you always have to learn non-pharmacologic treatment. That is absolutely important. Even if they are just asking for treatment, if they are not specifying what kind of treatment, then always write both pharmacological and non-pharmacological treatment. All right. Okay, next we have gastroesophageal reflux disease. This is also very important. GERD, its etiopathogenesis is very important. And yeah, in GERD there are first is mechanism, etiopathogenesis, pathophysiology is very important. This year we were also asked about treatment of GERD, which is also absolutely important. So for GERD, only the etiopathogenesis and the treatment is absolutely important. Inflammatory bowel disease, obviously the difference between Crohn's disease and ulcerative colitis is absolutely important. You have to learn. In my notes again I have written it in table form, so you have to learn that entire difference, and its treatment is also very important. Yeah, etiopathogenesis, mainly it is either due to autoimmune disease or due to other kind of disease, so that is not very much important, but the difference and treatment of IBD, it is very important. Liver disorders, ALD is very important. ALD, there are various stages of ALD. First is, I guess, fatty liver, and then fibrosis, then cirrhosis, I forgot. So that staging is very important in ALD along with its treatment. Okay, just don't write abstinence. That is not the main treatment for alcoholic liver disease, disulfiram is given, and then you also can give antioxidants, corticosteroids, antioxidants such as selenium, etc. So ALD pathophysiology and treatment is very, very important. Okay, viral hepatitis, it is not that important if we consider gastrointestinal system. PUD is important, GERD is important, IBD, ALD and jaundice is important. Viral hepatitis and drug induced liver disorders, they are not absolutely important, but you should know if it comes, then how you will write it. For viral hepatitis, only for hepatitis A and B vaccination is available. I guess for hepatitis A, that is Haverex and Vacta vaccine. So those two vaccination, their dose, their scheduling and the amount of vaccine given in each dose, that is also very much important. Okay, and for hepatitis B, I guess there is only first dose, second dose, like that only. But for hepatitis A, there are two kinds of vaccine, Haverex and Vacta vaccine. So you have to know everything about those two vaccine, that is what age they can be given, after first dose, how many months later second dose should be administered, how much of the second dose or first dose should be administered, such things, they are very important. And also I guess treatment also, because in hepatitis, I guess D, there are two kind of genotypes, genotype 1 and 2. So for that we give antiviral medicine that is based upon the ELISA counts of the viral load. So that chart is very much important. That chart is given in my notes. If you have my notes, then you will understand what I am saying. Okay, all right. So next we have drug induced liver disorders. This is also very important. They can ask two kind of question in this. They would either ask directly that write note on drug induced liver disorders, or either they would name liver disorders and then they will tell you which drugs cause them or how they are caused, or the treatment of drug induced liver disorders. So you have to answer it that way, and just don't write that you have to stop the therapy or lower the dose. You can also write that administer corticosteroids, administer antioxidants, nutrition therapy, hydration, etc. Alright, so you have to write that also. Next we come to hematological system. Alright, so for hematological system we have anemia, very important. Write a note on types of anemia, write a note for oral and parenteral therapy of anemias. It is absolutely important. You also have to know what is MCV, MCH, MCHC, etc. PCV values, and classify anemia not only on the other types, but also classify them according to microcytic, macrocytic and normocytic. Yeah, these three classification is very important. Then we have venous thromboembolism. In that pathogenesis, that is I guess Virchow's triad in that venous thromboembolism, so that is very important in the etiopathogenesis. And also anticoagulant classification is absolutely important in this. Okay, so treatment and pathophysiology or etiopathogenesis and treatment of venous thromboembolism is very, very much important. Alright, next comes drug induced blood disorders, absolutely important. You cannot skip that. Again, just as I said in drug induced liver disorders, I would say the same thing for drug induced blood disorders. What are the types of blood disorders, what drugs cause the blood disorders, and management of each and every type of drug induced blood disorders, it is absolutely important. In this, obviously stop the drug therapy or lower the dose of the drug. First of all, identify the medication causing the blood disorder, stop that therapy or lower the dose. Or you can administer this filgrastim injection, GCSF injection, such answers you have to give. Sometimes corticosteroid, blood transfusion, oxygen therapy is also needed. Alright, so that is done with hematological system. Anemia is important, VT, etiopathogenesis, treatment is important, drug induced blood disorders, everything is important. Alright, next we have nervous system and psychiatric disorders. I would combine them. So nervous system, epilepsy, Parkinsonism, stroke and Alzheimer's disease. Alright, Alzheimer's disease treatment is very much important. And for all these nervous system disorders and psychiatric disorders, mainly dopamine, serotonin, GABA and glutamate or noradrenergic. Yeah, these five, they will either go up and down. So the etiopathogenesis would be same, except you have to remember, for example, if it is a Parkinson patient, then he would have less of dopamine activity. If it is a schizophrenic patient, he would have more or less of dopamine activity depending upon prefrontal cortex's is stimulated or the mesolimbic pathway is stimulated. All right, for Alzheimer's disease it is more about, I guess, tau proteins. Yeah, it is more about tau proteins, and I can't I guess it was cleavage due to beta esterase, yeah, something like that. So those two mechanisms are very much important for Alzheimer's disease. Again, if you have my notes, that in that I have written the etiopathogenesis for Alzheimer's disease absolutely nicely. Okay, that is also cholesterol hypothesis and estrogen hypothesis. So, and obviously cholinesterase hypothesis is also there in etiopathogenesis of Alzheimer's disease, so that is very much important. So here etiopathogenesis and treatment is important. Treatment includes rotigotine, gabapentin, and there was third anticholinesterase agent that I forgot. So these three are important. Then I guess mementamine is given, then MAO, and all of those are common, you know, COMT inhibitors, MAO inhibitors, etc. They are common in each and every nervous system and psychiatric disorders. All right, then for stroke, all right, in stroke there are two types, there is ischemic and hemorrhagic. So how would you identify what are the symptoms, and TPA administration, how would you do, what dose you will give, antifibrinolytics, that is streptokinase, alteplase, tenecteplase, all those dose, and how would you start with these drugs, it is absolutely important. Okay, next we have epilepsy, amazing topic, types of epilepsy, treatment of types of epilepsy, done, literally. Okay, so that is done with epilepsy, Parkinsonism, stroke, and Alzheimer's disease. Next we have psychiatric disorders, and that's schizophrenia. Again, etiopathogenesis and treatment is important. In this we have atypical and typical antipsychotics. So the difference between atypical and atypical psychotics, antipsychotics, and they can also ask write short note on atypical antipsychotics or write a short note on typical antipsychotics. All right, so that is very much important. Then we have affective disorders, in that bipolar, mania, and depression comes. So yeah, bipolar disease is important, depression is also very important, especially how would you diagnose psychiatric disorders, that is very important. So that you should write according to DSM-4 or ICD guidelines only. Okay, so refer to those guidelines for the diagnosis. In my notes it is already given, but again, if you are someone who is not referring to my notes, then you should refer to ICD or DSM-5 or I guess DSM-4, I don't know. So those guidelines. All right, I think it is DSM-5 now, 5th edition has come up most probably. Okay, then we have anxiety disorders. In that we have general anxiety disorder, social anxiety disorder, panic disorder, I think panic, I'm not very sure, and also we have PTSD, that is post traumatic stress disorder. So these four, this is my favorite topic, anxiety disorders. So these four are important, especially that treatment is very much important. You will give benzodiazepines and SSRI, SNRI, MAO inhibitors, etc. Yeah, but benzodiazepines, they are not exactly first line of therapy because they can lead to withdrawal symptoms or dependence. So that also you have to mention. Okay, then we have sleep disorders, again my favorite. In this we have necrolepsy, restless leg syndrome. Then we have insomnia, sleep apnea. There are three kinds of sleep apnea, I guess. There is obstructive sleep apnea and positional sleep apnea. Yeah, so those you have to do, especially insomnia and necrolepsy is very important. For necrolepsy there is an amazing mnemonic, I think it is CHAP. Yeah, so C stands for cataplexy, H stands for hallucination. So that is hypnopompic and hypnagogic hallucination, I guess. Hypnagogic and hypnopompic hallucination. CHA stands for sleep attack. Yeah, and P stands for sleep paralysis. So these are the four symptoms of necrolepsy that you can identify, and it also acts as differential symptom because cataplexy is not seen in any other kind of sleep disorder. Alright, so insomnia, then necrolepsy and sleep apnea, these three are very much important. Alright, then we have obsessive compulsive disorder, very important. What is it? How you will identify what is obsession and what is the compulsion? How would you identify that? And its treatment. Treatment is mainly interchangeable in all the nervous system and psychiatric disorders. If you will learn, then you will slowly get to know about it. All right. So now we are done with gastrointestinal system, hematological system, nervous system, psychiatric disorders. Next we have pain management, including pain pathways, absolutely important. In this you will learn about nociceptive pathway, neuropathic pathway, and treatment. It would be non-opioid and opioid medication along with others such as antihistamines, anxiolytics are given. So yeah, these three things are very important in pain management, including pain pathways. So pain management is important. In pain pathway you will have nociceptive and neuropathic pathways. Then neuralgia, absolutely important. Trigeminal neuralgia, very much important. Especially there are non-pharmacological treatment, for example glycerol, lysolysis, then cryotherapy, decompression therapy, stereotactic radiosurgery, etc. So those are also very much important. You don't have to know exactly what kind of surgery is done. For GERD also there are loads of surgeries that are done, so you don't have to know what kind of surgery is done, but you have to know what happens in the surgery. Okay, like you should know name of the surgery and what is the mechanism. For example, as I said, this microvascular decompression surgery. So in that what happens is that there is, in neuralgia there is a nerve that is being pressed by a blood vessel. Okay, so what they do in decompression surgery is that they would put a sponge between the two so that the blood vessel no more is compressing the nerve. So that is the mechanism. This much you should know about every surgery that you write in non-pharmacological treatment. Okay, alright, then we have headaches, very important, especially migraine is important. Yeah, you can also draw small diagrams about which kind of headache is affecting which kind of face. For example, trigeminal neuralgia, you can draw a diagram of the nerve affecting occipital, maxillary, mandibular area. Then we have glossopharyngeal, occipital. So occipital you can show your head, and it is also known as goggle headache, I guess, so that you can show. Okay, then we have evidence-based medicine, very much important. Okay, so for evidence-based medicine there is also stages of trust or reliability of the evidence. First comes meta-analysis, then comes RCT, cohort, case control, cross-sectional studies, and then the last is the panel discussion or expert opinion, something like that. So that is absolutely important. What are the objectives of ABM and how would you conduct it? What are the stages of ABM? That is, I guess, ask, access, appraise, assess and apply. So that is very much important. Pico parameters are important, and then background and foreground questions is very much important. So this is done with PT3. I really hope that you guys have taken notes of the important topics, or either you can save this video to watch it later before your exams. Okay, so really don't make the mistake of reading everything first. You should read what all is important or what all is high yield topics. So whatever topics I told you right now or whatever points I told you right now, they are high yield, so focus on them first and then read the other things. Alright, now we will be discussing about my paper of Pharmacotherapeutics 3. Alright, so for Pharmacotherapeutics 3, discussing my university paper. My university is Gujarat Technological University, by the way. Okay, so we have total question paper of 70 marks. In that we have 7 questions. Now each question, I don't know if you guys can see, but as you can see that each question, for example, this is question number 7. Wait, yeah, so this is question number 7. So it is having 3 subparts, right? A, B, C, D, A, B, C, like the 3 subparts. And the first question A, it is always of 6 marks followed by 5 and 5. So yeah, like that we have 7 questions, and from 7 questions we have to attempt any 5. Okay, so 2 we can leave optional. So yeah, 7 questions, and each question has 3 subparts, 6, 5, 5, and from 7 we have to answer 5. This is the paper pattern of my university. Yeah, and not only my paper but other university papers or previous year papers, I always give them for free along with my notes. So if you have my notes, then you should take complete advantages of the papers that I provide you. Alright, Okay, so first question was discuss pathophysiology, clinical presentation and diagnosis of peptic ulcer. So the entire chapter of peptic ulcer was asked. Then we have pathophysiology, clinical presentation of Parkinson's disease, short note on classification system for anemias, as I told you, microcytic, macrocytic and normocytic. Okay, for normocytic it will be hemorrhagic anemia or anemia due to chronic diseases. Microcytic can be sickle cell thalassemia. Macrocytic will be hereditary spherocytosis, etc. Then next question we had, write short note on pain pathways. Both nociceptive and neuropathic pathways would come. In nociceptive you should also make a flow chart. I drew the entire diagram of spino-reticular system. Yeah, so that is important. In my notes it is already given. Write a note on non-pharmacological and therapeutic approach to manage GERD in adults. So that is also very much important. Discuss about steps involved in collecting evidence in evidence-based medicine. As I told you, ask, assess, appraise, ask, access, appraise, assess, apply. I'm sorry. So that is very much important in EBM. In this again you can write the pico parameters, which would be very much important. Then we have mentioned the various mechanisms that contribute to synchronous hyperexcitability in seizures. Discuss the treatment algorithm for the treatment of epilepsy. Then we have, in treatment algorithm you also have to write about types of epilepsy, because unless and until the type of epilepsy is established you cannot start with the treatment algorithm. Okay. Then we have discussed the types of neuralgias and its management. Compared, in management you have to write both pharmacological and non-pharmacological. Alright. Then we have compared the clinical and pathologic features of Crohn's disease and ulcerative colitis. As I told you that in my notes there are 2 tables given, so just mug up those tables and you are done. Describe the various stages of alcoholic liver disease. As I told you, there are different stages. First is, I guess, fatty liver, then fibrosis, then cirrhosis, like that. With the related symptoms, mention the complications of alcoholic liver disease. Write short note on general algorithm for diagnosis of anemias. In this, as I told you, you have to remember the values of MCV, MCHC, MCH, PCV, etc. And also hemoglobin, then I guess TIBC, that you should know. Define and classify stroke. So in this, hemorrhagic and ischemic stroke. Write a note on the pharmacological and write the note on non-pharmacological and pharmacologic therapy for ischemic stroke. Then we have 5th question is classify sleep disorders and enumerate the common etiologies of insomnia. As I told you, insomnia, narcolepsy and sleep apnea. These 3 are very much important. Then we have write a short note on non-pharmacological recommendations for insomnia. Then we have classified the stages of Alzheimer's disease. Write a short note on the treatment of Alzheimer's disease. Mention the common triggers of migraine. Okay, then discuss the treatment of acute migraine. 6th we have, for common triggers of migraine there would be smell, taste, light sensitivity, photophobia, phonophobia and stuff like that, stress or drinking alcohol, caffeine, smoking. Migraine is complex. Sometimes for some people a cigarette smoke can be other trigger factor, sometimes it can be a relieving factor, so it varies a lot. Okay, question 6 we have describe venous thromboembolism, that is VET. Describe the treatment for VET. In this, anticoagulant therapy and antifibrinolytic therapy is very much important. Write a note on management of drug induced blood disorders. Write a note on management of schizophrenia, atypical and typical antipsychotics, then MAO, COMT, all of that, it will come here. Question 7, last question, discuss the common etiology and management of jaundice. Okay, write a short note on the management of PTSD. Write a short note on H. pylori eradication therapy. So as I told you, for H. pylori eradication therapy, that is an amazing table in my notes. Really, it is very good. So you should definitely prefer that, and if you don't have that, then there is 4 kind of treatment. First is proton pump inhibitor based triple therapy, bismuth subsalicylate based therapy, that is bismuth based quadruple therapy, non bismuth based quadruple therapy, sequential therapy, and the last one I forgot, but it is for recurrent patient of PUD, it is for that. So yeah, these are the 4 to 5 kind of H. pylori eradication therapies given in my notes. That is it. I am so happy to talk to you guys again after such a long period of time, and I really hope that this video helped you a lot. And if it did, then don't forget to subscribe to my channel. There are loads of vlogs coming up, loads of hospital stuff, college stuff, project stuff, and also I would be uploading a video on how I perform DUE, that is drug utilization evaluation assignment, in my 4th year. So if you are 4th year student, don't forget to subscribe, and if you are someone who is just getting promoted to 3rd year, a huge best of luck. And really, if you are in 3rd year, just take my notes, okay? They will help you a lot. They will save you a lot of time, especially for pharmaceutical analysis and medchem. That is it. Goodbye, and I really hope that you guys are doing amazing, and hope to see you next time. Bye bye.
I walked across a burning bridge.